Jerry, as I said earlier. I'm 17 and I live on Vashon. And
I'm Amelia, I'm 16 and I live on Vashon.
I'm Ruby and I'm 18.
I'm Maya and I'm 16. I'm Leo and I'm 16. We're all in Vashon.
You guys are all from Vashon. Wow.
Yeah.
Okay. Cool.
And collectively, we are the Vashon Island Teen Council, a peer-led sex ed program designed to teach a more comprehensive, more inclusive, more detailed curriculum. This is our first year together, and already in the past 2 weeks, we've reached over 200 students in our local middle school, teaching classes such as gender identity and sexual orientation, healthy and unhealthy relationships, and creating safer environments to prevent bullying. We're the first in our district, as well as the first teen council in the nation to be affiliated with an organization other than Planned Parenthood. We work with them, but we're more organized by our local organization called DOVE, a domestic violence prevention agency based on Vashon, where Kyle and Tracy help us out a lot.
Cool. So familiar with DOVE? Important work. Well, that's great. I'm really glad that you guys are, taking leadership roles in helping make sure that that more of your peers understand, basics about reproductive health, reproductive freedom, and healthy relationships. So, anyone who wants to go next? Talk about go ahead.
So, I'm here to talk about the House Bill 1234, or the 12 months of birth control. So, being a young woman who takes birth control for a medical reason, this bill is very important to me because I take it because of a low iron deficiency and also extremely heavy periods that in freshman year led to fainting spells and immense pain. And a couple times I have missed my pill because of work and school and day-to-day life, and that does lead to very painful repercussions. Sometimes I'm not functional over my periods, sometimes I can't move. And it is a big enough problem across Washington, this particular deficiency, that I know several people like me just within my school of about 500 kids. So the way that this could help is if young people who want birth control can have it for those 12 months, there's not that fear of if I don't take time off work or if I don't do my homework, I have to go to the pharmacy. That might be a long way away. And that 12 months can easily turn into just taking it every day and avoiding that painful repercussion. And those medical responsibilities will be a lot easier.
Yeah, thank you. That's an important bill, and I think it's important to be thinking about stories like yours. So I think it's people need to understand there's a lot of really important medical reasons that women take birth control, and that having sustained access to it, particularly for women in rural areas, is really important. Vashon is rural, but places much more rural where you'd have to drive a long way to get to a pharmacy. That having a 12-month supply could do a lot to help women deal with conditions like yours, in order to avoid pregnancy or for any number of other reasons. So, I'm definitely a supporter of that bill. So thank you for bringing that up.
Yeah. My name is Ruby. I'd like to talk about the Affordable Care Act, and specifically the medical rights of transgender people. While I am on the trans spectrum, I don't require medical hormone therapy or surgery to affirm my gender, but there are people really, really close to me who take hormones regularly, and if the Affordable Care Act gets defunded in the way that Congress is talking about, it's a possibility that they will not be able to access those hormones, and they may even have to detransition, which can be really physically and mentally harmful. It's important to me personally because my partner is a transgender person, and seeing the financial stress that he's going through, and as I said, the mental and physical kind of anxiety that he has about it, it's really heartbreaking. And not only that, but anyone could come out in your life as trans at any time, and there are likely people close to you who could be trans and who could need those hormones. And not only that, but there are medical conditions that cisgender people could need hormones as well. So it's essential that access is continued to anyone who needs these hormones. So what will you do to protect the rights of transgender people and support the Affordable Care Act.
Well, so we don't know yet what Congress is going to do to the Affordable Care Act, and so we are sort of have to wait and see what changes they make before we can figure out what Washington's response will be. But Washington has been at the forefront of protecting the rights of transgendered people in our country. You know, we were passed non-discrimination provisions for transgender people more than 10 years ago, and of course those have been under attack lately. But we're not bending it all in now. We said that's important, and we're not going to to restrict what bathrooms people get to go into, like we've seen other states try to do, and one state succeed. So I will continue to hold the line on non-discrimination for transgender people, and then like you said, as if the Affordable Care Act goes away or is gutted in some way by Congress, then Washington will need to respond somehow. Whatever response we come up with will be expensive, and so we're going to need people to support revenue increases for the state so that we can make sure to keep the healthcare safety net strong. In Washington, we've been one of the best states about both implementing the Affordable Care Act, and even prior to the Affordable Care Act, extending healthcare to people who couldn't afford it in the old system. And so I just don't know that much about federal politics, but I'm just going to remain hopeful for the best possible outcome in DC, and then whatever they come up with, Washington will do our best job to maintain the protections that we have in place.
Okay, I'm Maya, and I am here to talk specifically about publicly funded family planning and the protection of those who need and depend on it. This is especially important to me because I was in an unhealthy relationship in which my partner didn't feel comfortable using condoms, and I loved him so much that I didn't want to lose him, and I didn't want to do anything that would make him break up with me. And my mother, who is incredibly supportive, did not support that, and I didn't really know who to turn to. And not only, this doesn't just happen to me, but 1 in 3 females and 1 in 6 males nationally, it's been reported, are affected by unhealthy relationships by the time they're 18. And so many more go unreported out of fear and out of a lot of different factors that go into that, out of not knowing that they're in unhealthy relationships. And so education and prevention of these things are really important to me because places like Planned Parenthood can provide that extra support that you can go to if you don't feel comfortable talking to other adults in your life or you don't really know where to go. And it can give people options of other birth control methods. Birth control pills don't work for me because of certain body reactions, so it's really important to keep our options open. So I'm here to ask how and will you can help support publicly funded family planning.
Well, I guess I need to hear from you how. Healthcare is not my specialty, and so I know that we've expanded access to family planning. The time I've been in the legislature, we know that it's one thing that improves access and improves people's lives for many people that rely on the state for healthcare, and it also saves the state money to get more money into preventable healthcare, so that we don't have to. It's much cheaper for the taxpayer to spend money on prevention than it is to spend on addressing conditions once they arise, whether that's pregnancy or another preventable condition. And we're not going to go backwards on that. But if there are things steps that you all think that we need to take to maintain that, then please communicate that.
Those are the issues that
Great. Well, thank you all for taking your holiday to come down and talk with us and advocate for reproductive health. It's really important, and I'm really glad that there's so many. So many of you on Vashon talking to your peers about reproductive health care and advocating for it. Obviously, it's this is a scary time for reproductive health care at the national level, and we just need more more young people aware of and talking about their rights and their healthcare needs. So thanks for doing what you're doing, and enjoy your day down here.
And thank you for giving us your time.
You're welcome. Thanks.